Hey, what's going on, guys? Welcome back to Fireman Fitness. So in today's video, I'm going to be doing a really quick patient assessment or trauma patient assessment. I only have 2 more weeks of EMT school, so I'm pretty excited, but at the same time, I'm really nervous. So I'm just trying to brush up on every little thing. We actually did a practice run on Saturday, and I only missed a few things. All this stuff that has check marks are the stuff that I actually got, and then I did forget to say assess lung sounds. So it's like little things like that that I have to brush up on. With that being said, let's get into the video. Hopefully you guys like it. Don't forget to give me a thumbs up, and yeah, peace. I'll see you guys in the next clip. Okay, for the sake of the video, I'm going to be using pillows because I don't have a live patient. So let's start off with the trauma patient assessment. So started off checking for, I'm doing my BSI, PPE, PINMAN when I arrive on scene. So BSI is body substance isolation, PPE is personal protective equipment. PINMAN is personal, partner, patient, public safety, environmental hazards, number of patient, mechanism of injury, nature of illness, additional resources, need for extrication. Yep, alright, so doing my general impression, checking for age, sex, weight, position, found any immediate life threats, and then delegate for C-spine. Approach the patient up from the feet up, so that way the patient, if he has a head trauma or neck trauma, he's not really twisting his head, he sees you coming up to him. So right, walking up to the patient, hey sir, are you okay? So I'm approaching the patient using AFPU. Right now I just did a verbal, alert, checking for alert, verbal. He's not alerted verbal to when I approached him and when I was touching him. So I'm going to check for painful stimuli. So, okay, patient is unresponsive. From there, I'm checking his ABCs. So, airway, checking if it's open, clear, maintainable, no need for suction or airway adjunct. Checking his breathing, which is rate, depth, effort. Checking for lung sounds. No need for oxygen. No need for no need for O2. Going down to circulation, check cap refill, skin color, temperature, any immediate hemorrhaging. Alright, so for the sake of the video and then my test, let's go on to the trauma patient assessment. So I'm checking the back of his head, checking my gloves, checking if there's any bleeding. I'm going to check the back of his neck again, checking for any step off. From there's no step off. Checking his head, checking his zygomatic arches, pretty much decap BTLS, and checking his jaw, make sure it's intact, checking his nose, make sure it's intact. I'm going to open his mouth, check if he bit off his tongue or anything, any missing teeth, any bleeding in general that needs suction right now. From there, I'm going to check for raccoon eyes, no raccoon eyes. I'm going to check the back of his ears for vital signs or cerebral spinal fluid. Going down to his neck, I'm checking for subcutaneous emphysema, JVD, medical alert tag, and then a stoma. From there, I'm going to cut and expose his chest, open it up, checking for decap BTLS, checking for any sucking chest wounds, flow segments, paradoxal motion, or flow segments, paradoxal motion, offset pressure, so push in, offset pressure. Okay, from there, I already know enough all the things I need to do. Checking his going down to his abdomen now. Decap BTLS, palpate for tick. So checking his 4 quadrants, upper and lower quadrants. Checking for distension, rigidity, guarding, hot belly, any pulsating masses. So none of that, all of it's clear. I'm gonna go ahead and expose his lower half of his body, which is his pants. I'm checking his pelvis now, so I'm gonna check for offset pressure. From right there, I'm checking for any priapism, any vaginal discharge, or incontinence. So he's all clear. So from right there, my first transport decision is stay in play because he has no immediate life threats, nothing that really affects the need for extrication or sorry about that part. So checking my first transport decision is to stay in play just because the patient doesn't have any immediate life threats and there's no loading goal criteria at the moment. So I'm checking his lower thighs, checking for offset pressure, palpating for tick, checking for any bilateral femur fractures, which is also a low to go criteria. Checking his knees for offset pressure, checking his calves for offset pressure. Okay, going down to his feet, I'm going to take off his shoes and socks. Checking his pulses bilaterally, checking cap refill. I'm going to mark his feet just to make sure, to mark the spots where I actually felt the pulse. And then I'm going up to his arms, checking for offset pressure, palpating for tick, cap refill. Checking for offset pressure, palpating for tick, checking for cap refill. From right there, we're going to roll the patient on the headman's count. 1, 2, 3. Okay, headman will count. I'm going to expose his back. Checking down his spine, make sure there's no offset or step off. Checking for flow segments, paradoxical motion, any sucking chest wounds, any impelled objects. Checking for wallet, roll the patient down. 1, 2, 3. Right there, we'll roll the patient on the backboard. Then the trauma patient assessment will keep on continuing. But with that being said, I don't know how to backboard, so that's the end of my trauma patient assessment. So I arrive on scene. My first things that I do is BSI, PPE, Penman, so body substance isolation, personal protective equipment. Penman is personal, partner, patient, public safety, environmental hazards. Number of patient, mechanism of injury, nature of illness, and additional resources, need for extrication. Alright, so I'm doing my general impression, which is age, sex, weight, position found, any immediate life threats, and then I'm going to delegate for C-spine. Alright, I'm going to approach the patient up from his legs up, so that way if that patient has any neck or head injuries, he's not turning his neck, he sees me coming up, he just move his eyes and that's it. So I'm approaching him from his feet up. Hey sir, are you okay? Are you okay? You approaching the patient using AFPU, so right now I just check for alert and verbal. Right now I'm doing painful stimuli because he wasn't responsive to me, so I did painful stimuli. Patient doesn't have any reaction to my painful stimuli, which is a trap pinch. So I'm going to move into my trauma patient assessment. So right now I'm checking for his airway, which is open, clear, maintainable, no need for suction or airway adjunct. Moving on to his breathing, which is rate, depth, effort, but listen to his lung sounds. No need for O2. Checking his circulation, which is cap refill, skin temperature, moisture, stuff like that. So checking, for circulation. Any immediate hemorrhaging that I don't see right now. So right now I'm going to his head. I'm going to go in the back of his head with my gloves. I'm going to pull back and make sure there's no bleeding on my gloves. Checking back on his neck. Checking for any step off. From there I'm checking his head. Checking for decap BTLS, checking his zygomatic arches, checking if they're intact, checking for his nose, make sure it's intact, no deformities, checking his jaw, opening his mouth, make sure he has no blood that needs to be suctioned, any like biting on his tongue, any missing teeth of the sort. From there, check his back of his ears, check for any battle signs or cerebral spinal fluid. From there, I'm going to be, I believe that's it for the head, if I'm not mistaken. Yeah, I said raccoon eyes already. So I'm going to check his pupils as well. From there, I'm going down to his neck, checking for checking for JBD, subcutaneous emphysema, medical alert tag, and then a stoma. He's good on that, so I'm going to kind of expose his chest, open his shirt. From there, I'm checking for any paradoxical motion, any offset pressure, any flow segments, sucking chest wound, or, and I already said impelled objects, so I'm going to check. Okay, this thing's sturdy. So from there, I'm going to go down to his lower abdomen. I'm going to check I'm going to palpate his 4 quadrants. So I'm also checking for any distension, rigidity, guarding, hot belly, or pulsating masses. He's all clear right here. I'm going to cut his lower extremity, cut down and expose his lower extremities. Right now I'm at his pelvis. I'm checking for offset pressure, making sure his pelvis is sturdy. I'm checking at his pelvis for any priapism or vaginal discharge or incontinence. He's good right there. Right now I'm doing my first transport decision, which is stay in play due to the fact that the patient has none immediate life threats. He has no load and go criteria at the moment, so I'm going down to his lower extremities, which is his thighs. I'm checking for offset pressure. Checking for any bilateral femur fractures, which is also a load and go criteria. Going down to his knees, checking for offset pressure. Going down to his calves, checking for offset pressure. Going down to his feet, I'm going to take off his shoes, take off his socks, checking for pulse, and then the cap refill, I'm going to mark down where I found the pulse. Going up to his arms, I'm checking for offset pressure, checking cap refill, offset pressure on the other arm, cap refill. From there, we're going to do a log roll on the headman's count. 1, 2, 3. Now I'm checking his spine, going down his spine, checking for any step off, for any offset pressure, for any flow segments, sucking chest wounds, any pulsating masses, any checking for his wallet. Log roll down 1, 2, 3. Alright, there, we put him on the backboard, and then that will be the end of my trauma patient assessment. Then we'll do a load and go. From there, we'll go in the back of the ambulance to do additional assessments, but this is part 2, second try, second attempt. I'm probably going to do 4 attempts just so I get it right. I know I missed some stuff, so moving on to part 3. So right on scene, check for my first things I'm going to do is my BSI, PPE, and penman, which is body sepsis isolation, personal protective equipment. Penman is personal, partner, patient, public safety. Environmental hazards, number of patients, mechanism of injury, nature of illness, additional resources, need for extrication. Now I'm doing my general impression, which is age, weight, sex, position found, any immediate life threats, any immediate hemorrhaging. I'm going to delegate for C-spine. I'm going to approach the patient up from his legs up just in case he has any head, neck injuries. He sees me coming, so he's not moving his head. So I'm checking him. Right now I'm approaching the patient using APU. So, hey sir, are you okay? Are you okay? So patient wasn't alert to verbal. He wasn't tracking you with his eyes. So I'm going to do a trap pinch. Patient is unresponsive because he wasn't responding to my trap pinch. Okay, now I'm going to go into my trauma patient assessment. I'm going to go back of the head with my gloves and make sure there's no blood on my gloves. Check the back of his neck for a step off. Okay, from there, I'm going to his head, checking for his zygomatic arches, any raccoon eyes, any displacement of his jaw, nose. I'm opening his mouth, make sure he has no bleeding in his mouth that needs suction. Shoot. Alright, I'm on scene. BSI, PPE, penman. I already did my acronyms already in the last couple of videos. Now I'm doing my general impression, which is age, sex, weight, position found, any immediate life threats, and delegate for C-spine. I'm going to approach the patient up from his legs up, just in case he has any neck injuries. He doesn't move his neck just to see me. Right now I'm approaching the patient using APU. Right now I'm checking if he's tracking me with his eyes, which he's not. Hey sir, are you okay? Are you okay? Which is verbal. Patient is not responsive. I'm going to do a trap pinch. Okay, patient is unresponsive. I'm going into his ABCs, checking his ABCs, which is airway. Open, clear, maintainable, no need for suction, no need for airway adjunct, breathing, rate depth, effort, no need for oxygen, circulation. I'm going to check his cap refill, skin temperature, color, any immediate hemorrhaging. I don't see any, so now I'm going to my patient trauma assessment, checking the back of his head with my gloves, checking for any bleeding, checking the back of his neck for any step off. From there, I'm checking his eyes, for any raccoon eyes, any zygomatic arches, checking zygomatic arches, make sure they're intact, checking his jawline, make sure it's intact, checking his nose, make sure it's intact, no bleeding, open his mouth, make sure he didn't bite off his tongue or any missing teeth, any blood that needs to be suctioned. Now I'm checking the back of his ear, and for any vital signs or subrenal spinal fluid, covering his head, going down to his neck, checking for any subcutaneous emphysema, jugular vein distension, JVD pretty much, any medical alert tag or stoma. He's clear. Cutting his shirt, exposing his chest, checking for offset pressure or paradoxical motion, flow segments, sucking chest wounds or impaled objects, pushing his rib cage, checking for paradoxical motion, going down to his abdomen. I'm going to palpate his 4 quadrants, checking for distension, rigidity, tenderness, any guarding or pulsating masses. He's clear right there. Right now I'm going to go down to his pelvis, expose his lower extremities by cutting it off or cutting down his pants, exposing his lower extremities, checking for offset pressure offset pressure. Now I'm on his pelvis, checking for a prior prism, vaginal discharge or incontinence. He's cleared. My first load-and-go criteria or transport decision is to stay in play. Patient doesn't have any immediate life threats and has no load-and-go criteria. Going on with my patient assessment, I already know this is how we're being tested, so that's why I'm saying there's no, yeah. So going on to the lower extremities, checking for his thighs, checking for offset pressure, any bilateral femur fracture, which is also a load-and-go criteria. Going down to his knees, doing the same thing, offset pressure, palpating for TIG, checking his calf, palpating for TIG, offset pressure. I'm moving his shoes, removing his shoes, checking his pulse. Okay, I'm marking his feet where I found the pulse, cap refill, going up to his arm, palpating for TIG, offset pressure, cap refill, offset pressure, palpating for TIG, checking cap refill. On the headman's count, we're gonna log roll the patient. 1, 2, 3. Okay, checking down his spine, checking for step off, any impaled objects, sucking chest wounds, flail segments, checking his wallet, make sure he has a wallet or not. Log roll man, go down. 1, 2, 3. Okay, and that'll be the end of my trauma patient assessment. 3 minutes and 39 seconds. Yeah. Alright, so on my fourth take of doing the trauma patient assessment, I got 3 minutes and 39 seconds, I believe. Let me double check. Yep, 3 minutes, 39 seconds. I'm gonna try to do it one more time, my 5th attempt, and I'm gonna try to like kind of talk a little bit more clear. And yeah, so let's get into it. Hope you guys like the video so far. Getting really close to my finals. I'm just trying to get like an A on it. I want to pass everything but flying colors, and this is a part of the section that I just need to work on. So if you guys have any advice, I would really appreciate it at this time. So feel free to drop it in the comment section below. Don't forget to give me a thumbs up, guys. Sorry, I'm talking really fast and I'm kind of stumbling on my words right now. But let's get into take 5. Take 5. All right, so I wrote one scene. First things I do is BSI PPE penman, so body substance isolation, personal protective equipment, personal, partner, patient, public safety, environmental hazards, number of patients, mechanism of injury, nature of illness, additional resources, or need for extrication. I'm approach the patient up from his legs up. I'm approach the patient using AFPU, which is alert, checking his eyes. If he's tracking me with his eyes, he's not. Hey sir, are you okay? That's verbal. He's not responding to me, so painful stimuli like using the trap pinch. He's not responsive because he's not acting to my trap pinch, so I'm going to check his ABCs, which is airway. Checking if his airway is open, clear, maintainable, no need for suction or airway adjunct. Going down to breathing, which is rate, depth, effort, no need for oxygen. Circulation, checking cap refill. He doesn't, checking his cap refill. Skin temperature, any immediate hemorrhaging. I don't see any immediate hemorrhaging, so I'm going on to my patient assessment. Checking the back of his head with my gloves. Checking my gloves, make sure there's no blood. Going back of his neck, checking for any step off. Going down to his head, checking for decap-BTLS. Checking his zygomatic arches, make sure they're intact. Checking his jaw, make sure it's intact. His nose is intact. Opening his mouth, making sure the patient doesn't have any bleeding, any missing teeth that just fell out, or any blood in general that needs to be suctioned. Checking his eyes, checking for his raccoons, or checking his eyes, make sure he doesn't have raccoon eyes. Checking his pupils. Going back to his ears, checking for any vital signs. Checking for any subbrachial spinal fluid. From there, going down to his neck, checking for subcutaneous emphysema. Checking for JVD, any medical alert tags or stoma. I'm going to expose his chest, open his chest, checking for any paradoxical motion, sucking chest wounds, impaled objects, or I believe that said flail segments. Okay, pushed in. Okay, he's good. Going down to his lower abdomen, I'm going to palpate all 4 quadrants, checking for distension, rigidity, tenderness, any pulsating masses, or hot belly. He's good. Exposing his lower extremities, checking at his checking his pelvis, checking for any vaginal discharge, priapism, or incontinence. He's great. My first transport decision is to stay in play. He doesn't fall into any load-and-go criteria. Going down to his thighs. Checking for decap-BTLS, palpating for TIG. When I was at his thighs, I'm checking to make sure he doesn't have any bilateral femur fractures, which would be a load-and-go criteria. Now I'm at his feet. I'm going to take off his shoes, take off his socks, check his pulse bilaterally. I'm going to mark where I found the pulse at. Check for cap refill. Going up to his arms. Checking his arms, palpating for TIG. Checking for offset pressure. Check for cap refill. Go up to his other arm. Check palpating for TIG, offset pressure, cap refill. Now we're going to log roll the patient on the headman's count. 1, 2, 3. Now I'm checking his spine, going down his spine, checking for any step off, any impaled objects, sucking chest wounds, fill out segments, checking for wallet. Now we'll roll the patient down, and that'll be the end of my trauma patient assessment. That last one was 3 minutes and 17 seconds. Let's go.